In this video, I'm going to look at newspaper articles in Singapore from the 1970s to around the early 90s. And it's about the history of genetic screening. So first, these are the tests available for pregnant women today. I got this from KK Women's and Children's Hospital. You can see that around 9 weeks, there is a test called the First Trimester Screen. And around 15 weeks, there is something called the Maternal Serum Screen. And non-invasive prenatal testing can be done from 10 weeks to all the way to the end. So comparing these three tests, all of them use blood tests. The first one can test for Down syndrome, trisomy 13, 18, and other birth defects. And they use ultrasound and a blood test. The non-invasive prenatal testing also tests for the same, and it boasts like a higher rate of detection, which is 99%. Maternal serum screen is also a blood test, but it's not so accurate, so 60 to 70%. So first trimester screen. So they combine ultrasound with the blood test. The ultrasound will look at the neck fold of the baby. So if it looks a little bit thick, then they will say, okay, let's do further testing for Down syndrome. And the other two use blood tests. That's why it's called non-invasive, because they don't have to put a needle through the belly or use a tube to go to the cervix, as we'll look later. So if, according to those three non-invasive, what I mentioned before, those three tests, if there seems to be a suggestion that the baby has some kind of trisomy, then nowadays, they will offer the invasive testing. So one is called amniocentesis, where the needle will be inserted through the abdomen to remove a bit of amniotic fluid. And then CVS, chorionic villi sampling, they also insert, they go through the abdomen and then try to get a piece of tissue from the placenta. So because this is invasive and it does puncture the amniotic sac, there is a risk of miscarriage. Here they state at this hospital, the public hospital, the rate is 1 in 300. And information from a private hospital, Thomson Medical, there are two, under the non-invasive prenatal test, there are two kinds. This is called, one is the Harmony test and one is the Panorama test. So I remember, I think each test cost about $400 or $500. And these are all based off the blood from the mother. But in the 70s and 80s, we can see that there was a bit of debate as to why, because there was no universal screening being done for pregnant women. And so there was still a bit of debate of what kinds of testing there are these tests safe, and also should we test for them. So in 1974, there's an article called Mongolism Still a Threat to Unborn Babies. So Mongolism was the old name for Down syndrome. So here they describe amniocentesis. During the 12 to 14th week of pregnancy, a needle is inserted into the sac and some fluid is extracted, and then they are analyzed. So since 1967, so about the last 7 to 8 years, about 3,000 pregnancies were monitored in this way in Singapore. So that is maybe about, and every year there were about 300, okay, a bit more. Let's say it was about one per day, maybe one per day every year. And it says it is not no more painful as a needle in the arm. And they seem quite optimistic, so the accuracy of the test approaches 100% and the risks are quite low. So even though most pregnancies will be normal, they said that, if abnormalities were known, some parents may have decided to abort them. 1975, 1 in 150 is born abnormal. So they mentioned that 10% of, 1 in 6 pregnancies ended in spontaneous abortion, that means miscarriage, and about half of these abortions had some kind of chromosomal abnormality. And for Down syndrome particularly, they said about half who had Down syndrome miscarried and the other half were born alive. 1981, should Mongoloid babies be allowed to die? So, and questioning the ethics. So there was a case of this doctor called Leonard Arthur in London, I think. Yeah, okay, in London. He was charged for murdering a 3-day-old baby suffering from Down syndrome. And the article mentions this Dictionary of Medical Ethics, which also came out on the same day, which points out that active killing of a baby with a birth defect, rather than allowing to die, it weakens the moral basis of medicine as a life-preserving enterprise. So the trial of this doctor brought up the question of whether babies with serious handicaps should be allowed to die soon after birth or treated as vigorously as possible. Some doctors and lawyers do not doubt that the withholding of medical treatment equals killing. Others are sure that the burden of caring for a severely handicapped child is too great to impose on a parent. And they said since Down syndrome can be detected using amniocentesis, it should be allowed so that women can choose to abort their fetus if they want, and therefore avert future legal and ethical problems. Meaning, if they kill the baby before it's born, then they don't have to deal with the ethical issue of killing the baby after it's born. So 1967, they said that, the Abortion Act of 1967 in Singapore, it largely removes the conflict between the conscience of a doctor wanting to help a patient, that is to abort the baby, and his wish to keep within the law, because before 1967, abortion was illegal. In the case of that doctor, he was cleared of attempted murder. Attempted murder? So did the baby die or not? Wait, it did die, right? So this doctor deliberately prescribed a powerful pain-killing drug and gave instructions for nursing care for the baby boy only to ensure it did not survive. Okay, so the baby died. The doctor maintained that he did nothing to accelerate the baby's death and just allowed nature to take its course. But he did give a drug that allowed the infant to die as humanely as possible. 1981, a survey was done in London, and it says that 70% of British pediatricians believe that handicapped babies who are rejected by their parents should be allowed to die. 1981, it was a case of this mother who had twins, and one was supposedly diagnosed with Down syndrome. And okay, she was 40 years old. She had never had children before. She was infertile for 18 months before the pregnancy. And she wanted to have desperately a normal child, but could not face the burden of caring for an abnormal child for the rest of her life. So using the two techniques you mentioned earlier, using ultrasound, okay, to properly detect, doctors pierced the heart of the abnormal twin with a needle at 20 weeks and withdrew blood. This caused cardiac arrest. And then the dead fetus were died, and it began to shrink, and then the other fetus kept growing. And then she gave birth. So she found out that one of the twins had Down syndrome. So she had to decide between aborting both babies or just that one. So she wanted to just abort that one. But this was the first time that they did this. Doctors had done this, which is to just abort one. She said that if her request was refused, she would have aborted both. So some risks included injecting the wrong fetus or also injuring the other fetus. Another risk, coagulated blood from the dead fetus could enter the bloodstream, cause brain damage, and so on. 1982, another case of a parent allowing a birth defect baby to die. So this baby had Down syndrome, and then also his esophagus was not properly formed. So the baby was left alone and denied food, water, and medical aid. And after 6 days, he died. 1982, designer-made babies. So this article is an example of this very optimistic framing of technology. It says, it is possible in a not too distant future, only a generation away. The new science of screening children in the womb and the moral dilemmas it will pose. Now, this article is accompanied by a drawing of a scientist and a very happy looking baby. So they mention here two tests. One is chorionic villi sampling, CVS, as I mentioned earlier. They said using this technique, they had 80% accuracy in identifying Duchenne's muscular dystrophy. So that's 80% is not good enough. So they call this a lethal degenerative illness. So this, all this genetic screening, it raises certain ethical and emotional problems. Because Down syndrome or spina bifida are now grounds for abortion. But what about other conditions? So such as diabetes or heart disease, which is something that an infant develops later in life, but they may be born healthy. So Professor John Scarisbrick from an anti-abortion organization, he describes abortion based on genetic screening as the ultimate barbarism. It shows the hypocrisy of our society that we work hard for the born handicapped, giving them ramps, special toilets. Yet before their birth, we are doing everything we can to seek them out and kill them. Well, he said either children with Down syndrome, either they are human beings or they are not. Okay, the moral dilemma is as to whether parents should be allowed to abort fetuses with only mild handicaps. Is one which should ultimately disappear if scientists can learn how to replace or manipulate the affected gene. So, of course, until today, this is still not possible. But it's just, like I said, this article is showing, very optimistic view of the technology. In 1983, so this is in the 80s, there was a lot of talk about eugenics. If you recall, in 83 to 84, there was the Graduate Mother Scheme, a state family planning scheme, which gave incentives for graduate mothers to have more children and for non-graduate mothers to have less children, with a system of financial incentives and disincentives. So here, there were a lot of articles in the 80s talking about Down syndrome. Besides what I show you, there were also articles showing how children with Down syndrome can have a normal life. So here is more neutral, explaining what is Down syndrome. They mentioned that using ultrasound and amniocentesis, they can quite accurately test if a fetus has ultrasound. However, they say, okay, well, even though this is a great leap forward, a pediatrician at KK Hospital said, this technology is still in its infancy, and we do not know if there are any adverse effects with X-rays. I'll link here a video that I have about ultrasound and X-rays. With X-rays, we did not know about the side effects until much later. So X-rays in pregnancy were done well into the early 80s, which is, about the right, or the late 70s. And then so ultrasound replaced X-rays. So they mentioned that carriers of Down syndrome do not manifest the defects and are usually intelligent. So accepting that they have a child with Down syndrome is very hard for them. The better educated the parent, the harder it is. It is even more difficult for those who have been Western educated. There is a fatalism in the East which leads Orientals to accept it, but those with a Western education want to change things. Meaning, if those with a Western education, if they knew their child had Down syndrome or any kind of birth defect, maybe they would want to abort it and not have it. So here they mentioned also a woman in her 30s is considered high risk because she should be screened for birth defects or other disorders for the fetus. And they mentioned here already, 1983, early and regular antenatal checkups are very important because during these checkups, doctors can determine future complications. These drawings that accompanied that article, they show the development of the fetus over 12 weeks. So because specifically they're talking about the test, right? Amniocentesis. So they show that, okay, 3 weeks, there's not much. You cannot see much of the fetus. 4 weeks, neither. And then 12 weeks, you can see, it starts to have a human form. And they claim that, okay, by 12 weeks, you can tell, 14 to 16 weeks, they can tell whether the fetus will have Down syndrome or not. And this allows the doctors time to do abortion if they find any other major abnormalities. 1983, there was an article in the Malay newspaper. If you are close relatives, don't marry. So talking about genetic fitness, there was a Malay doctor, Dr. Haji Zailan, who wrote, Dr. Haji Zailan Ahmad. Okay, so he wrote a publication called Kecerdasan Otak dan Kesihatan Tubuh Badan. So mental fitness and physical health. So he mentioned that it's still quite common to find close relatives marrying each other in the Malay Muslim community. This including this has a risk of Down syndrome, and also if the woman is 35 years old and above. And in Singapore, 1 out of 600 babies are found to have Down syndrome. But if the woman is 35 and above, then the risk jumps to 1 in 200. This article asks, is it possible to determine the genetic makeup of the fetus? For mothers who are pregnant with fetuses with lethal illnesses, they can make their own choices, meaning they can choose to abort or not. For them whose fetuses have been diagnosed to have diabetes or heart defects, they have a more difficult decision to make. Okay, here they mention as well, the test for muscular dystrophy is very expensive. If we have fewer children with this condition, that means if we abort them, then the amount that we save can be used to treat other disabilities. I mean, again, all hypothetical. 1983, nature's own selection helps cut the risks of Down syndrome. Basically, it says that how many percentage of I think just now they mentioned like half of fetuses with Down syndrome will end in miscarriage. So here, this mother with a Down syndrome baby was very scared when she got pregnant again. She did amniocentesis. They did a culture and found everything was normal, but she aborted the child. The procedure itself is not without risk and can cause abortion. Okay, it's not clear whether did she choose to abort or was it because of the procedure that she had a spontaneous abortion or a miscarriage. Because here they mentioned that amniocentesis can injure the fetus if the needle punctures the placenta. Here I thought it was interesting okay, oh, sorry, at the end here we see, by doing amniocentesis, the doctor may trigger premature labor. So it is difficult. So it's like they have this test, amniocentesis, which is trying to detect Down syndrome, and therefore you might decide to abort. But then the procedure itself can cause miscarriage. And then even if your fetus is normal, you might end up in miscarriage. You might end up losing the baby. Well, okay, on the right-hand side, I think this was interesting. The professor said, we feel life begins at conception. We have to weigh the factors. And that as medical doctors, we are trained to save lives. It goes against the grain to ever want to terminate life. And that even goes for therapeutic abortion. So that means abortions for reasons of a defect, birth defect. There's a lot to say about the rights of the unborn, but there's also something to say for the rights of parents to not be saddled with a child like this for the rest of their lives. Therapeutic abortion is never done at the physician's own volition. It is always because the parents want it done. So they say the doctor never makes a decision for the parents. This is the picture accompanying that article. It is an ultrasound machine, Sonic 8, that's the brand. 1985, why genetic screening is important. This is Dr. Lee Wei Ling, the daughter of Lee Kuan Yew. If you have a child in a family with muscular dystrophy, don't have any more children. All the women in the family who might be carriers should go for screening to see if they have the defective gene that will perpetuate the ailment down the generations. However, in Singapore, doctors find that parents of such patients, so meaning parents, the patients are the fetuses here, do not wish to have further studies, nor do they want genetic counseling. But the only way is to prevent. Eventually, all patients of Duchenne muscular dystrophy either die of respiratory failure or heart disease. It is a very tragic ailment, and I think that we should prevent it as much as we can. So, digress here. I do know many boys with Duchenne, boys and men, Duchenne muscular dystrophy, and they can live well into their mid-20s, barring, extra medical treatment, even with, weak respiratory function. And in your mid-20s, you can have a good life. So in this case, saying that just because you have Duchenne muscular dystrophy, you should die as a fetus, I find that quite sad, because it's the worry, they make the parents worry about a hypothetical situation rather than thinking about how to best support such parents who have children with muscular dystrophy. So they do admit that there is no foolproof way of diagnosing this actually. Consultant neurologist at SGH says that sometimes what looks like muscular dystrophy may not be so. There are cases of misdiagnosis. But he said the best way to determine is to go for blood and electromyogram tests. 1985, again, abnormal babies can be detected earlier now, so that you can have abortion earlier. So this is 85. Okay, under the present technique, abortion can only be done after the 4th month. But this new technique, I guess CVS, can cause a spontaneous miscarriage in 5 out of 100 women. But women might want a new method because they prefer to abort earlier when the fetus is not so properly defined. 1987, they're talking about this CVS. They claim it can detect Down syndrome as early as 9 weeks. However, because the results are not so, they're only suggestive, some worry that you may end up aborting normal babies rather than the defective ones. The tests are often a prelude to abortion. Okay, CVS was introduced in 83. They used to go through the cervix, but now the new method goes through the belly. So that's what they do now. Less risk of hitting vital, of injuring the fetus. This article also mentions a blood test that can be used to detect neural tube defects, such as spina bifida, hydrocephaly. They mention that children with spina bifida may be mentally retarded and frequently have no bowel or bladder control. So again, to encourage parents to, well, not encourage, okay, to inform them to make a choice whether to abort or not. But it seems that, in the 80s, despite all this available, parents either do not do the test, probably because of the cost, and of course, then they don't choose to abort. Accompanied by this very distressed-looking mother overwhelmed with so many tests. 1988, there are earlier tests for unborn babies. The new, faster method seen as a big help in abortion decisions. So again, we see that the purpose of all this screening is to actually decide whether the baby should be aborted or not. So they mentioned the procedure. This is 1988. They mentioned that CVS is being used alongside amniocentesis. Okay, so 1988 CVS was new. Amniocentesis had been done for about 15 years before this, so since 75. And then CVS is new as of 88, and it says it's new and a faster method. And it's being done at Kanakaba Hospital, so the public hospital, Alexandra private hospital, Singapore General Hospital, and National University Hospital, so the public hospitals. Also used in some, it's Alexandra Public Hospital? Okay, maybe there was. Okay, it's also Thomson Medical Center. So they had a workshop on prenatal diagnosis, and they very specifically mentioned CVS. Okay, because they want to avoid late abortion, meaning 19 or 20 weeks. Because they said that the patient, the mother, can have quite severe psychological repercussions because of late abortion. So they want to have abortion earlier. This is an advantage. And the doctor from Nottingham, he urged couples with a family history of chromosomal disorders, enzyme defects, or genetic diseases to make use of this screening method. So note that it's not a universal screening yet. There are certain groups which are high risk and that should be screened. 1988, women below 35 need screening too. So before that, it was 35 and above that had to go for Down syndrome screening. Okay, most of the 50 babies born with Down syndrome each year are actually below 35. That's why they should also be screened. So there was a public lecture here called Your Genes and the Health of Your Children. This was a public lecture. And it's talking about how you can detect 80% of Down syndrome with blood tests, measuring the thigh bone. and checking the neck folds of the fetus. A chromosomal analysis of every fetus is highly labor intensive and not feasible. He's also called Singapore's Mr. Childcare. Intelligence is shaped by both genetics and environment, but it is the environment that will ensure to what extent the genetic input, that is the intelligence, will be fulfilled. It is true if you marry someone who's intelligent, at least you can be assured of that genetic pool, but then you must make sure you have the right environment for intelligence. Okay, at this time, it's still impossible to diagnose all abnormal babies, but they do want to reduce the number of such babies being born. In response to that article, Edmund Dunn, who was chaplain of the Catholic Medical Guild in Singapore, he asked, is this good medicine? The purpose of screening is to kill a baby with Down syndrome before it is born. He mentions that, children with Down syndrome can be treated and get therapy and have a happy life and also bring joy to the parents. The long-term consequences of elimination on the incidence of inherited diseases at conception are slight and not necessarily beneficial. 1991, why moms-to-be should see docs. So this was a case of a woman whose baby died when she gave birth in the toilet. She had not seen a doctor during her whole pregnancy. And this article basically is saying like the different risks and dangers just of pregnancy itself, during labor and also during delivery. So basically it's dangerous like all the way through. I thought this quote was quite funny at the end. Doing the dangers of unsupervised pregnancy. Doing something like that is like getting into an airplane and trying to fly it without knowing how to fly. In other words, don't do it. 1993, routine test to help you have a normal baby. Written by a doctor from a hospital, private hospital. It mentioned that some maternal illnesses, such as diabetes and hypertension, are associated with higher chances of having a premature and abnormal baby. So the importance of doing routine testing, such as checking your urine for sugar and protein, take a family history of congenital abnormalities of the mother, of the husband, or close family, do a meticulous checkup, do regular ultrasounds, do routine laboratory investigations, such as here as G6PD enzyme deficiency. Although the overall incidence of congenital malformations is about 2 to 3%, that means 97 to 98% of the time you will most likely have a normal and healthy baby. But do not be complacent. But also do not be unnecessarily worried about abnormality. Here they say any national program for such screenings must consider the statistic, weigh the costs and the benefits and the complications of such a program. So that's it for this video. See you in the next one.